Welcome back to Good Morning San Diego. There is a tremendous need for more donated organs in the United States, and today a new effort is starting in San Diego to help address the situation. Scripps Health has launched a centralized organ recovery center for deceased donors, marking the first time the specialized approach has been deployed in San Diego County. Joining us to talk more about this recovery center is Dr. Christopher Marsh from the Scripps Center for Organ Transplantation. Dr. Marsh, thank you very much for making time for KUSI.
Thank you. Happy to be here this morning.
All right, so to give us an idea, how have we normally handled organ donation?
Well, that's a good question. Typically, when organ donors are identified at the hospitals throughout our region, the life sharing goes and works with the local hospitals and ICUs to try to manage the donor and then get them to their OR. But it can be complicated because some donors need to be managed for a prolonged period of time, which is problematic for busy ICUs that have lots of patients and trauma, or they may need to hurry. And what's been identified that the centralized organ recovery efforts that have slowly been stood up across the country has increased the number of organs by about 25%. So at Scripps, we felt that it makes sense to do this for our donors within our system and bring them to a focused team that would work with life sharing to manage the donor, whether it be a more prolonged process or a more hurried process, depending upon the nature of the organ donor's stability.
So explain why the centralized approach is faster and consequently will save more lives.
Yeah, so it can be faster or it may need to be slower. So the intent is to move it to Scripps Green, where we don't have trauma and we don't have an emergency room, and we've got an ICU team that will support life sharing and manage the donors. And so having a consistent process, supporting the family and the organ donor management is key. In some instances, because of the effort to take care of alive patients, that we can't always get things done timely in terms of evaluating and managing the donor. Where if we have a dedicated team to do this, it would help improve the function of the organs, which then improve allocating those organs to patients.
All right. So I understand that, and plus, I guess we get talking about donors, and we forget the human element of what families are going through, and so this is a way to also treat the families with dignity, is it not?
Yeah, exactly. And I think once the families made the commitment, they really want to, when they've given the gift of life, they would like to know that what's being given, that there can be all the organs used to help save lives. So, we're basically managing the family's desire to have patients saved by their gift of life.
Dr. Marsh, I don't think we can have a conversation like this without reviewing the fact that organ donation, it's needed, right? I mean, we're talking about...
Yes, it's tremendously needed. I mean, there's over 100,000 people on the wait list in the U.S., and there's about 20 people that die each day waiting for a transplant, and our lists keep growing. So we need to make sure that we maximize what we get, and if we don't do it right, then we may only be getting livers and kidneys, for instance, but if we can do a better job improving the donor, then we can get hearts and lungs and save people on the list that are waiting for those urgent transplants.
Lastly, Dr. Marsh, old guy like me, do you still want my parts, my used parts?
Yes.
So that's a message for everybody, right?
Exactly.
All right.
Please,
Doctor,
please give.
Well, that's the first thing I do whenever I fill out my license, and I encourage everyone to do the same. Dr. Christopher Marsh, thank you very much.
Thank you for the time.
And good luck with the centralized approach.